Structure attached to the tip of the fibula. Anterior lateral collateral ligament, middle bicep femoris, posteriorly popliteofibular ligament. LCL is tight in extension and lax in flexion. Compared to MCL, it is separated from the lateral meniscus. Lateral structures of the knee. Layer 1, iliotibial band and bicep femoris. Common peroneal nerve runs between layer 1 and layer 2. Layer 2, patellar retinaculum. Layer 3, superficial, is lateral collateral ligament, anterior longitudinal ligament, fibulofibular ligament. Deep is arcuate and coronary and popliteofibular ligament, popliteus tendon and capsule. Function of the lateral structures is the primary restraint for various stress tests. Secondary restraint to posterolateral rotation. Treatment, repair posterolateral approach, suture anchors for avulsed ligaments.